Hello, welcome to The Moment. This time I have an interview with Atul Malhotra about the Malhotra Group's newest development in Grey Street. And I'll also be talking about a recent rise in car theft as discovered by the RAC. But first I have an update on the inpatient beds at Rothbury Cottage Hospital. It looks like, as David Blakeburn told me recently, the Clinical Commissioning Group, or CCG, are permanently closing the beds. The Northumberland Gazette ran the story in which they say, quote, there were cries of shame and give us our beds after the Joint Locality Executive Board of the Northumberland Clinical Commissioning Group made its contentious decision at Morpeth Town Hall. Members voted unanimously in favour of permanently closing the inpatient ward and shaping existing services around a health and wellbeing centre at the hospital. The members also turned down an alternative bid put forward by the Coquetdale community to reopen the inpatient ward and develop a health and wellbeing centre on the site. The decision will now go to Northumberland County Council's Health and Wellbeing Overview and Security Committee, which will consider the ward's future during a public meeting at County Hall on October the 17th. Now, on the 6th of October, the Gazette also published a letter by a Dr. John Lewis, who it says in his letter that he's been working for most of his life in medical research. And he talks about the unscientific nature of the CCG's closure of the beds. The letter reads, quote, many questions have been raised and were raised again at the meeting about problems the people of Coquetdale might suffer without the beds in Rothbury. So what was the answer? It was to retrospectively look for evidence of whether any problems had been flagged since the beds had been closed. None was found. In the world I worked in, that kind of retrospective, uncoordinated, informal investigation on an unsuspecting experimental population would have counted for nothing. As things worked out, it seemed that the Rothbury beds were closed as an experiment, without telling the people of Coquetdale that they were being studied, and evidence of harm to patients was sought. The letter goes on after that, but that was the main thrust of what he was saying. And it very much ties in with what David Blakeburn told me in the interview that we'd done months ago, that the beds were closed without any proper idea of what people were going to do in the interim. They closed the beds and then tried to find evidence to justify the closure. And according to David, really, the whole point of it was just as a cost-saving exercise, and they were trying to, in his view, find other reasons to justify it. Now, obviously, this line of thinking on the part of the CCG is completely backwards, and the Save Rothbury Cottage Hospital group have said on Facebook that their leader, Katie Scott, will be attending the meeting on the 17th to try and convince the council to listen to their side rather than the CCG. But of course, only time will tell if this will be achieved. So now let's look at the first story. Grey Street in Newcastle may be about to receive an update. The Malhotra Group are planning to develop a new hotel complex replete with rooftop pool and nightclub. The expansive development is definitely an ambitious project, and I spoke to Atul Malhotra, Operations Director at the Malhotra Group, to talk about it in more detail. So, could you start by telling me a little bit about the Malhotra Group's history, please?
Yes, my father came to this country in the late 1970s and was working in a newspaper shop, and was within a few years married with some kids, two boys at the time, and then his brother joined him from India, and in the late 80s started what is now known as the Malhotra Group, but it started out in the rag trade, the clothing industry, and then some residential property, and that was slowly followed in 1991. He formed a company called UGC Holdings, which was probably the starting point for the group. The group consists of three very diverse areas: a commercial property portfolio, up in down the country with some international and national covenant strengths, a residential and nursing care portfolio. We own and operate purpose-built specialist care units. We've now got, we're running and operating 12 at present, with aspirations of building another half a dozen or so. We're currently at just under 600 beds, with aspirations of reaching at least 1,000. And then also the leisure and hospitality industry, and within that the portfolio is very diverse, everything from hotels to hostels to upmarket bars and restaurants to pubs. So we're currently at about just over 1,100 employees as a workforce. So that's a little bit about us. The main board members are my father, my uncle and myself. And it's the three of us. It's a family-run business. All the shares are currently owned by the family, with maybe a vision or a strategy in years to come of maybe floating, selling a little proportion of it. We're not sure yet. It all depends on market factors. But at present we're still very active in the business, particularly my father, who is the chairman of the group. And it's good fun.
So why is the project in Grey Street happening? What was the impetus for that?
The project in Grey Street has been in the pipeline for over 10 years now. We've been slowly collecting all the buildings and purchasing the buildings on Mosley Street, on Grey Street, and the Cloth Market. And the vision is to create, a jewel in the crown for the city centre. It's to create and leave a legacy for the family as well. And it's to put Newcastle, we feel, on the map, not just locally but nationally. And the vision is a very exciting one. There's a lot of hard work involved, and I think the hard work starts now. It's took us, like I said, over 10 years to purchase all the buildings, and now work has actually started with surveys and plans, and we've started discussions with the local council, who are extremely positive about the project. And it's to create basically a one-stop shop. It's to create an upmarket 4-star, 5-star hotel. We're currently in negotiations with an international operator to come on board. It's to create a rooftop terrace, a bit like Soho House in London, with a rooftop swimming pool, a nightclub, a spa, a gym, conference facilities, banqueting facilities, and one of the most important factors is we're going to create a new street for the city, Drury Lane, which is probably one of the most exciting elements of the project.
Yeah, definitely. Okay, so what specific buildings are involved?
As I mentioned before, it's took us nearly 10 years to collect these champagne assets, champagne trophies as I like to refer them to. We own Bambra's, where the famous Blade and Racer starts, which is on the Cloth Market, down to the Flares building, and then on Mosley Street down to and around Grey Street, and a large part of the Grey Street block. And we also own the Grey Street Hotel across the road from there as well. So it's quite a prominent set of buildings we own, and they're on the entrance of the city centre, so if you come down from 55 degrees north. So it's quite a prominent block, and we're very proud to own such real estate in the city centre.
So what makes the complex unique?
It's unique in the fact that it's going to be a one-stop shop, and it's going to cater for all types of clientele of all different ages, and within the block, there's going to be so many different offerings. There's going to be the best part of a dozen offerings, from a hotel to a rooftop space to a nightclub to a smoking terrace to a spa, a gym, restaurants and bars. So it's multi-purpose and multifunctional.
So what are the companies and groups involved with the project then?
It's solely us, just the Malhotra Group. It's a family-run business. It's a family-run entity, and the block is owned by just the family. So it's took us. It's the best part of a £35 million project.
Because I thought I saw in the Chronicle story that they said there was another architect involved.
Yes, they are our architects who are helping us design and build the project, but they're not involved in terms of ownership of the block.
No, okay.
The ownership is fully in the name of the family.
Okay. So you mentioned that it was going to cost $35 million. Exactly what's that going on?
Yeah, I think the initial outlay on the buildings has been significant, in excess of £15 million in purchasing the buildings. But we've estimated the design cost and the full project cost is going to be around the £20 million mark. But with ground listed buildings like that, there needs to be a contingency, so we feel it's going to be a £35 million development in terms of including the purchase and also the fit out cost, because like I said, it's took us 10 years acquiring all the assets, so we feel the £35 million mark is a fair reflection of how much the whole project is going to cost. But we've also going to have to build in some contingencies because of we're working very closely with the Heritage England, who are very keen to bring the buildings back to its former glory and keep all the high ceilings and the cornices, and so I have to work very closely with them.
So how's it going to help the economy of Newcastle?
Like I said, we currently employ just over 1,100 people at the minute. We feel this block alone, in just the design build phase, is probably going to create in excess of 200 jobs. But once we deliver the whole project, it's going to be probably in excess of 200 full-time employment jobs as well. So it's just doing our little bit to keep the economy booming in the northeast.
So is this part of a larger development scheme, or is this just a standalone project?
No, this is a standalone project. We're currently working on various projects in the group. We've got aspirations of spending at least £100 million over the next 7 years on just development, which includes this block, but also various other care homes, and we're currently building another hotel in Gosforth, and also bringing other properties that we own back into life as well. Smaller empty buildings, and it's took us 18 months or so to secure some planning permissions. So the next sort of 7 to 8 years are extremely exciting in terms of just development only.
So what's the estimated time frame for the build?
Well, from what I understand, we'll start sort of the pre-app discussions with the council, and we're hoping to secure planning permission by the start of the summer next year, and then full development work to commence probably within 6 to 12 months after that. So we're looking at maybe a start date of maybe the start of 2019, and it's going to be probably a 2-year completion. But the building, the block will probably open a little bit by bit, rather than waiting for it to open on full completion. It'll open in parts.
Okay. And do you know who's going to manage the hotel when it's done, or is that yet to be decided?
It's yet to be decided. Like I said, we're currently in dialogue with an international brand, and hopefully be in a position within the next 12 months to make the announcement on that as well.
It sounds like the group are very keen to make this project work within the spirit and design of Newcastle, which is definitely a very important thing. Obviously, it'll still be a while before anything official starts on the build itself, but this is a very interesting development that I will be keeping an eye on. So now let's move on to the final story. The RAC has reported a sharp rise in car thefts. The motoring organisation made a Freedom of Information request to 40 police forces in England and Wales. From the story on their website, they say that, quote, 85,688 vehicles were stolen in 2016, up from 65,783 in 2013. London was the area where the most vehicles were stolen, with a total of 26,496 thefts in 2016, accounting for a third of all reported thefts. This was up 29% from 2013 figures, when 20,565 vehicles were stolen. The West Midlands also reported a high number of vehicle thefts and one of the largest growths in the past 3 years, with thefts increasing from 4,161 to 5,930. The highest increase was seen in West Yorkshire, where thefts rose by 57% from 3,561 to 5,597. According to RAC Insurance Director Mark Godfrey, quote, technology advances in immobilizers, keys and car alarms had caused the number of vehicle thefts to decrease significantly from more than 300,000 in 2002. But sadly they have now increased after bottoming out in 2013 and 2014. We fear that thieves are becoming more and more well equipped with technology capable of defeating car manufacturers' anti-theft systems. They also include a map in the story showing the locations of the 40 police forces that they contacted and the percentage change in thefts since 2013. On this map, Northumbria Police has apparently seen a rise by 30% in vehicle thefts. Now, this sounds like a lot, but of course the map also shows the Metropolitan Police Service with a 29% change, and that's of course with London having the most reported cases. So the percentage change in thefts really isn't the best metric to determine how severe the issue is, because even a small increase could be a significant percentage increase. The Office for National Statistics published in July the latest findings of the crime survey for England and Wales, and in particular the overview of vehicle-related theft. This document talks generally about the trends in vehicle-related theft, the groups most likely at risk, and the nature of the thefts. Now, this survey isn't going to be the most accurate, as the document itself says, quote, figures on vehicle-related theft offences are included in the crime survey for England and Wales and police-recorded crime data, although the information available from each source and their coverage differ. The CSEW is a household survey, and as such includes offences against private households only, but relates to vehicles owned by any member of the household. Further down, it goes on to say, the CSEW provides a better measure of national trends in vehicle-related thefts, but police-recorded crime data provides a good measure of offences at a subnational level, where the sample size of the CSEW is not large enough to yield estimates with reasonable levels of precision. They also say, quote, care should be taken with regard to historical police-recorded crime data, as changes in recording practices following the introduction of the Home Office counting rules in April 1998 and the National Crime Recording Standards in April 2002 typically resulted in an increase in the number of crimes recorded. So, looking at Section 3 of the document regarding the long-term trends in vehicle-related theft, it says, over the last decade, vehicle-related theft has accounted for around 1 in 7 crimes covered by the CSEW. At peak levels in the early 1990s, this crime type accounted for around 1 in 4 crimes estimated by the survey. Similar proportions are found in the number of vehicle offences recorded by the police across the same time period. The estimated number of CSEW vehicle-related theft incidents rose steadily from 1981, before peaking at 4,293,000 in the year ending December 1993. This increase is fairly consistent with the general increase in crime during this period. This level held for the year ending December 1995, following which the estimated number of incidents declined steadily over the last 2 decades to a low of 790,000 incidents in the survey ending March 2017, with minor year-on-year fluctuations during this period. In the survey year ending March 2017, around 4 in 100 vehicle-owning households have been victims of vehicle-related thefts. This compares with around 20 in 100 vehicle-owning households in the year ending December 1993, meaning that the likelihood of households being a victim fell by around 80% compared with 1993. The section concludes by saying, quote, "The striking rate of reduction in vehicle-related theft since the 90s is thought at least in part to be due to improvements in vehicle security. Alongside this, there are a range of other hypotheses put forward. For example, evidence from the Home Office research report on the drug epidemic of the 80s and 90s suggests that the rise and fall of vehicle-related theft could be partly attributed to the changing levels of illegal drug use." So the numbers show a huge decrease over time in the amount of thefts, but of course they do have to be taken with a pinch of salt because they are so broad, and the surveyed sample of people, especially in the CSEW, may not be large enough to give a wholly accurate picture. And of course there's the ever-present problem of underreporting as well. So these figures are of course just recording people who have reported a vehicle theft. It's not surprising to some extent that vehicle crime is still a problem despite new technology. The kinds of opportunists who try to steal vehicles will find a way around most deterrents. But returning to the RAC article, Mark Godfrey says, "Anti-theft devices such as steering locks, which were popular in the 80s and early 90s, are starting to make a comeback, as they are still a very effective, visible deterrent. This is quite ironic, as they were replaced a number of years ago by alarms and immobilizers, which, until now, offered better protection." It's difficult to tell whether vehicle crime has actually started to rise again, or if the findings of the RAC's investigation were simply the result of better recording methods. But it will be interesting to see when the next CSEW figures come out to see if they reflect the findings of the RAC. So now let's take a look at the Home Office report that the ONS overview mentions. This is from July 2014 and is entitled "The Heroin Epidemic of the 1980s and 90s and its Effect on Crime Trends Then and Now." I think this will be a useful piece in explaining why crime in the area of vehicle theft has been so low over the last couple of decades. The introduction to this report says, quote, "The particular focus of this study is on the relationship between illicit drug use and crime. It examines the potential crime impact of the marked changes in the number of users of opiates and crack cocaine that have occurred since 1980. Now, Chapter 2 is called An Overview of Crime Trends and Explanations of the Crime Drop, and it breaks down various types of crime over the last 30 years, but most applicable are figures 3 and 4, which show charts relating to burglary and vehicle theft trends during that time period, comparing police-recorded crime data and CSEW findings, just as the Office for National Statistics overview did. The charts show that, quote, "Nationally, there was a high degree of consistency across these crime types. They all rose, peaked in the mid-1990s, and then fell together. It is worth noting that for police-recorded crime, there was a small fall in trends in the late 1980s prior to the sharp rise. The CSEW was not carried out between 87 and 91, so it would not register this, but the consistency with which it appears in the PRC trends suggests that it was a genuine lull in the rising crime. So, moving on to Chapter 4, which looks at the relationship between opiate use and crime. They start by talking about 36 previous studies and some of the points where there was consistent agreement between them. Some of these points were, quote, studies that measured self-reported offending amongst opiate and crack users, which for the purposes of this report has been abbreviated to OCUs, generally found very high numbers of offences, certainly high enough to impact national-level crime trends. Point 3 in this list that they cite here is probably the most pertinent. It says, quote, apart from drug dealing, the most common crimes were theft offences. For instance, a sample of 1,075 treatment seekers from across England and Wales recruited for the National Treatment Outcome Research Study self-reported 27,787 theft offences in the previous 3 months, an average of 26 per person. In a smaller study of 210 illicit drug users in Scotland, recruited from community settings, users admitted committing theft on 108 days per year on average. In volume terms, shoplifting stood out as the most common crime type, but cohorts generally reported a wide variety of theft crime, including burglary, vehicle theft, and robbery. So, from this alone, it's possible to see how the trends in vehicle theft, being most prevalent in the 80s and 90s, does potentially relate to the higher amount of drug use at that time. And certainly what they're saying here is that the people who mostly used these drugs did tend to engage in these crime types. Now, this paper is incredibly well researched and sourced, and I would recommend looking through it yourselves if you're interested, and of course I will link it in the description. Of course, the correlation between high opiate and crack usage and vehicle crime doesn't necessarily mean that it was only or even mostly drug users stealing vehicles, but the decrease of both drug use and vehicle crime in recent decades shows this was certainly a factor in the higher prevalence of vehicle crime during the 80s and 90s. I would have thought that it would be unlikely for levels in vehicle crime to return to the kind seen then, and as I mentioned earlier, the recent spike that the RAC are reporting on in this story may be due to simply better recording techniques or more reporting of vehicle thefts in general. And that's all for this episode. Next episode I'll be trying a different upload schedule, so instead of Friday morning, I'm aiming for Friday evening. Hopefully this will reduce the chances of any internet difficulties that the last couple of episodes have been hampered with. Until next time, I'm Oliver Ralph, and this is The Moment.